Leg twitching. Common causes. Most of the time, muscles do not move unless the brain signals for them to do so. However, these signals sometimes get mixed up. The mix-up may occur in the brain, the nerves that send the signals, or the muscles that receive them. When signal misfires occur, the muscles can move involuntarily, which people usually refer to as a twitch. Twitching is the result of the sudden contraction or release of a muscle. Doctors may use the term myoclonus to describe these first involuntary twitches. In this video, we outline the types of muscle twitches that may occur in the legs and how they might feel. We also list some common causes of leg twitches. Types. There are two basic types of sudden muscle twitching: physiologic myoclonus and pathologic myoclonus. Physiologic myoclonus. Physiologic myoclonus can affect people with a good health status, and it usually does not require treatment. Examples of physiologic myoclonus include hiccuping, leg twitching when falling asleep, physiologic startle responses. Pathologic myoclonus. Pathologic myoclonus refers to myoclonus that is either a symptom of an underlying medical condition or a reaction to a particular medication. Pathologic myoclonus can involve persistent muscle contractions that may affect an entire group of muscles or muscles in different parts of the body. Severe cases may affect a person's movement and mobility. What it feels like. A person who develops a twitch in their leg usually notices when it is happening. The twitches may be irritating, but they are not usually painful. However, muscle twitches in the legs can sometimes trigger muscle cramps. Cramps are very common, affecting roughly 60% of adults from time to time. Depending on the cause of the leg twitching, a person may experience additional symptoms such as tingling, itching, burning, throbbing, crawling, or fizzing sensations, muscle spasms in the affected area, a feeling similar to a shudder rippling through the body. Common causes. It is very common for people to experience occasional bouts of leg twitching. We outline two common causes of leg twitching. One is benign fasciculations. The medical term for repetitive involuntary muscle twitching is benign fasciculation. It affects about 70% of the general population and is rarely associated with serious nervous system disorders. Some possible causes of benign fasciculations in generally healthy people include stress or anxiety, physical exhaustion and lack of sleep, overconsumption of alcohol or alcohol withdrawal, overconsumption of caffeine or caffeine withdrawal, low blood sugar, dehydration, nutrient imbalance, hormone imbalance, use of certain medications. Restless leg syndrome. Restless leg syndrome or RLS is a condition in which a person experiences uncomfortable sensations in their legs. An irresistible urge to move the legs often accompanies the sensations. About 80% of people who have restless leg syndrome also experience leg twitching while they sleep. The medical term for this is periodic limb movements of sleep. Restless leg syndrome is common, affecting up to 1 in 10 people at some point in their lives. Less common causes. In most cases, leg twitching is due to a common and relatively benign cause. However, persistent or frequent leg twitching can sometimes signal an underlying nervous system disorder, such as Alzheimer's disease. Lewy body dementia, epilepsy, Huntington's disease, amyotrophic lateral sclerosis or ALS. Diagnosis. A doctor will typically diagnose the cause of leg twitching by taking a complete medical history, gathering specific information about the twitching, such as where it happens and how long it lasts, whether it affects other parts of the body, when it happens, looking for signs of toxicity due to medication use, illicit drug use, environmental hazards. In some cases, a doctor may order one or more of the following diagnostic tests: electromyography or EMG, a test that records electrical activity in the skeletal muscles. Doctors use EMG to assess the condition of the muscles and the nerves that innervate them. Electroencephalogram, a test that detects and records electrical activity in the brain. MRI scan, a medical imaging test that allows the doctor to view nerves and other soft tissues inside the body. It can also help them detect lesions that may be the cause of involuntary twitching. Blood test. Certain blood tests could help identify underlying medical conditions that may be responsible for the symptoms. When to see a doctor. Most of the time, leg twitching is a response to specific circumstances such as exhaustion, dehydration, or the use of stimulants such as caffeine or alcohol. However, twitching can also be a sign of a serious underlying medical condition. People should see a doctor if the leg twitches do not get better following appropriate lifestyle changes. Leg twitches persist for more than 2 weeks. Twitching starts when the person is resting. Twitching begins after the person starts taking a new medication. Twitching affects more than one part of the body. Twitching occurs alongside any of the following symptoms: fever, headaches, nausea, vomiting, weakness.